Have you torn your ACL and been told you might need surgery? Or are you wondering whether it can heal naturally without an operation? This is one of the most common questions I get asked as a knee specialist working across the UK and India, and the answer is not completely straightforward. Some ACL tears may cope without surgery. A small number may even show signs of healing on scans, but many patients still develop instability, repeated giving way episodes, meniscus damage, and long-term arthritis if the knee remains unstable. So in this video, I'll explain what the ACL actually does, whether it can heal naturally, who may avoid surgery, and who should seriously consider reconstruction. The ACL, or anterior cruciate ligament, is one of the main stabilizing ligaments inside the knee. It prevents the shin bone from sliding forwards and helps control twisting movements. ACL injuries commonly happen during sports involving sudden pivoting, twisting, landing, or change of direction. Football, basketball, skiing, rugby, and cricket are common examples. Patients often describe hearing or feeling a pop, followed by swelling, pain, and instability. Now here's the big question. Can an ACL tear heal without surgery? Traditionally, ACL tears were considered incapable of healing properly because the ligament sits inside the knee joint surrounded by joint fluid, which interferes with normal healing. However, more recent studies suggest that some ACLs may demonstrate partial healing, especially when the tear is partial rather than complete. The ligament ends remain close together, the knee is protected early, and rehabilitation is done properly. Some MRI studies have shown signs of ligament continuity after non-operative treatment, but here's the important point. An MRI that appears healed does not always mean the ligament functions normally. The real question is not just, has the ACL healed? The real question is the knee stable enough for the patient's lifestyle and activity level? There are broadly two groups of patients after an ACL injury. The first group are called copers. These patients may manage very well without surgery. They usually have low-demand lifestyles, do not participate in pivoting sports, have minimal instability, have good muscle control, and commit seriously to physiotherapy. Some patients can return to cycling, gym work, jogging, hiking, and even some recreational sports without reconstruction. The second group are non-copers. These patients continue to experience instability, giving way episodes, or lack confidence in the knee despite rehabilitation. This is especially common in younger or athletic patients involved in football, basketball, rugby, martial arts, or activities involving twisting and cutting movements. Repeated instability episodes can damage the meniscus and cartilage further, increasing the risk of early arthritis. So in these patients, ACL reconstruction is often recommended to restore stability and protect the knee long-term. Now let's talk about what the evidence actually says. Recent studies suggest that structured rehabilitation alone can produce good outcomes in selected patients, especially lower-demand individuals. Some major clinical trials found that not every ACL tear requires immediate reconstruction surgery. A proportion of patients treated initially with physiotherapy were able to avoid surgery altogether. However, patients returning to pivoting sports generally have higher instability rates without reconstruction. There is also evidence that recurrent giving way episodes increase the risk of secondary meniscal injury and cartilage damage over time. So the decision should never be based purely on the MRI scan. It should depend on your symptoms, your age, your activity level, your sporting goals, associated injuries, and whether the knee remains unstable after rehabilitation. Another important misconception is this: many people think ACL surgery automatically prevents arthritis. Unfortunately, that is not completely true. Even after reconstruction, some patients still develop arthritis years later because the initial injury itself can damage cartilage and menisci. The goal of ACL reconstruction is mainly to restore stability, improve function, and reduce further injury risk. Now let's discuss what non-surgical treatment actually involves. Avoiding surgery does not mean ignoring the injury. Successful non-operative treatment requires a high-quality rehabilitation program, focusing on swelling reduction, restoring full movement, quadriceps strengthening, hamstring strengthening, balance training, neuromuscular control, and gradual return to activity. Some patients may use functional ACL braces during sports. Although evidence on long-term benefit is mixed, rehabilitation is absolutely critical whether you have surgery or not. So who may avoid ACL surgery? Potential candidates for non-operative treatment include patients with partial tears, older patients, less active individuals, people without instability symptoms, and patients willing to modify activities who should strongly consider reconstruction. Younger athletic individuals, patients with repeated instability, combined meniscus injuries, high-demand sports participation, or patients whose knees continue giving way despite rehabilitation. So what's my clinical opinion as a knee specialist? Yes, some ACL tears can cope without surgery, and selected patients can function very well with structured rehabilitation alone. But a completely torn ACL rarely returns to completely normal function naturally, especially in active individuals involved in pivoting sports. The key is individualized treatment. Not every ACL tear needs surgery immediately, but not every ACL tear should be ignored either. The best treatment depends on the patient sitting in front of you, not just the MRI scan. If you found this video helpful, subscribe for more evidence-based knee care content, and let me know in the comments. Would you choose physiotherapy alone or ACL reconstruction if you tore your ACL?